afternoon. My name is Lolly Harris. I am here on behalf of Miss Georgia. I have been assigned her caseworker to evaluate and just go over her background, her medical history, her current situation, her diagnosis, as well as treatment options. Miss Georgia has been living at an independent care center for seniors for about 2 years, and she only takes medication for arthritis and her high blood pressure. The nursing staff as well as her family has raised a couple of concerns regarding her declining state in cognitive abilities. She has been leaving the front door open and unlocked, which is very unlike her, and she has been missing noon meal times as well. Normally she is pretty excited about going to any meals and any functions, and at this time she is just not really showing interest in that. There was a little bit of confusion in one instance here pretty recently. Her family is pretty close by, so they tend to see her every weekend to come and visit her and just check up on her. Her grandson did come and visit her last week, and he was saying that Miss Georgia was not able to recognize who he was. She actually thought that her grandson was her son. So after them realizing that there were a little bit of differences with Miss Georgia, they did want more testing to be done. And so before we arrived at the diagnosis that we have now, there were more medical exams and neurological testings just to rule out any medical illnesses that could be causing the memory loss, the apathy, and the confusion. All of those tests came back pretty normal, and so we have arrived to the diagnosis that Miss Georgia has an early onset of Alzheimer's, and her symptoms seem to be showing an early onset of dementia as well. So the Alzheimer is a deterioration of the brain tissue causing the memory loss. Over time, there is plaque that develops around the neurons in the brain, which impede the electrical impulses to reach other neurons. So the information that is supposed to be passed on to the other neurons to tell the body what to do is not being passed on because of that impediment. And the dementia is used as an umbrella term. It's basically more for the group of symptoms that are regarding the memory loss and the decline in learning and language and other cognitive abilities, like we see with Miss Georgia, missing her meal times, which is like an apathy. She is not really feeling the drive and the motivation to get up and take care of, those daily activities like eating, and also the memory loss with the confusion with the grandchild and forgetting to close the door. And so with all of these, we have noticed that the diagnosis for dementia and Alzheimer's, the severity of it is very mild at this time. Therefore, we have gathered a list of treatments and recommendations to be able to possibly reduce the deterioration of neuron death. With dementia and Alzheimer, unfortunately, at this time, there is no cure. But we do have the following recommendations that would decrease the rapid decline and deterioration of neurons. Medications are normally not recommended with the elderly because these patients tend to be very sensitive to the side effects of medication. And so we normally try and offer alternative approaches, such as a behavioral approach. We will be working with Miss Georgia to start psychotherapy to reduce the depression, the apathy that she's feeling at the moment, where she's not wanting to get up and maybe, go to the living center to eat and to be social with other people. Other things that are very important in this aspect are external aids such as grocery lists, to-do lists, contact lists, and we need to make sure that we put these in areas where are visible to her so that when she is having memory loss, she is able to look at it and remember, oh, okay, I need to be, getting this at the store today, or I need to be getting this done today for the chore, and if I need to call anybody, that list is up there for her to be able to see that since she won't be able to remember at that time. With lifestyle recommendations and changes, this will include not only exercise but also diet. Within the exercise, we would want Miss Georgia to start yoga and more cardio based type exercises a little bit more regularly. A couple times a week would be great. And that's just to prevent the cognitive decline and to increase blood supply to the brain to help those neurons work and connect with each other. And with the diet, we will be working with the nursing staff so that they are able to provide more fatty acids to her diet, and that's just to help with the brain function as well. And social recommendations are important. It's important for her to engage in pleasurable activities with other people, and you can be doing this with yoga, and you'll be getting that exercise and that cardio. You will be getting those hormones up and feeling great, and also being with other people and enjoying those activities with those around you are going to be very, very helpful for her psychological health. We would also recommend that maybe once a week, Miss Georgia goes out and plays bingo with her friends, or again doing those things that she genuinely enjoys doing with other people and just connecting with other people. The cognitive activity exercises that we would recommend for Miss Georgia also help with the slowing down or reducing that decline in deterioration of the neuron. And so with this, we would increase your brain activity with reading newspaper daily and possibly playing Sudoku, and just kind of using the use it or lose it approach. We have been working closely with the nursing staff at the living center that she has been in these last 2 years. We have also been talking to the doctors and her family to make sure that the recommendations that we have offered for her treatment options are integrated not only to her independent living situation but also in the care center. And psychoeducation is also very important, not only for the patient but for the family. And of course, if you have any other questions or any other concerns and recommendations, please feel free to reach out. Thank you so much for your time.